Medicaid often finds itself at the center of the healthcare debate.
The Senate health care bill strengthens and secures Medicaid.
The motion to proceed will mean deep cuts to Medicaid.
More than 66 million people depend on this government program, which provides health insurance for low-income Americans, including children, pregnant women, and people with disabilities. Now, there's plenty to suggest that having health insurance matters. Studies show people who are insured see their doctors more often, which helps them better manage their chronic illnesses and visit the emergency room less. People who are uninsured, on the other hand, often don't see a doctor until life-threatening circumstances force them to. It's a tough way to live. Their treatment usually costs more, and if they can't pay, you guessed it, taxpayers foot a large part of the bill. So why the big debate over Medicaid expansion? Well, each state shares the cost of funding Medicaid with the federal government. When the Affordable Care Act, also known as Obamacare, was signed into law in 2010, states were required to expand Medicaid coverage to include all adults under 65 with incomes that fell below 138% of the federal poverty level. If states didn't expand Medicaid, they risked losing federal funding. But a Supreme Court decision in 2012 removed that threat to states' budgets, allowing them to decide whether or not to offer that expanded coverage without the risk of losing the money from the federal government. And more recently, the Trump administration has made it clear it wants to reduce funding for the program overall. Basically, critics argue states can't afford to pay for Medicaid expansion. Proponents say they can't afford not to.